Welcome to the Substitution Treatment module. We're glad to have you here. In this module, we'll learn more about substitution treatment. Along the way, Dr. Scott MacDonald will answer some frequently asked questions.
I'm Dr. Scott MacDonald. I'm a family doctor who works in downtown Vancouver at Crosstown Clinic.
Why might someone consider starting substitution treatment?
Well, one of the myths is people need to hit rock bottom, right? That is a myth. It's not whenever people are ready, and that could be short term. Oh, I realize I'm using opioids daily now for the last week, 10 days, and I'm starting to have cravings and some sweating and noticing some withdrawal symptoms. So, ideally, we would attract people into care early. As little as 8 weeks of injection opioid use, and people may be looking at a lifelong problem. So there is some urgency and sort of a critical window where we would like to be able to attract people into care who are particularly injecting street opioids.
To learn more about substitution treatment, have a look through the topics below.